Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
By design, a look at the changing scene in auxiliary utilization, business office procedures, facilities design, and contemporary trends in the management of a modern dental practice.
Dentistry has changed significantly in recent years. There's an increased supply of dentists, with each one being more productive than ever before. And the competition for an adequate patient pool is very keen. Young practitioners are challenged to develop a broader approach to building a successful practice. Here to discuss the basic concept of marketing in dental practice is Mr. Doug Young, Vice President of Marketing for a major design and consulting firm. Doug, it seems to me that one of the obvious concerns that a graduating dentist has is building an adequate patient pool, and marketing, I think, probably is a significant piece of information that they need to deal with. How would you apply the marketing concepts to dentistry in particular?
First of all, Chuck, I think that society itself is in a period of major change, and I really believe this is true of dentistry as well. I think that many people are concerned about some of these changes, but for me, I think the opportunities for dentistry in this period of change are enormous. I think they're excellent. One of the things, though, that seems to be happening is that private practice seems to be in a period of redefinition. Private practice seems to be really asking itself the question, what business are we really in? And when I consider the people who come to us with the group that I'm associated with for help, I find that most of these people are involved with practices that I would call humanistically, health-centered, holistically oriented practices. And they're increasingly asking us about really three issues. One is marketing and communication, the other is team leadership, and the other is systems.
I'm intrigued, Doug, by something you referred to. So many dentists right now are pessimistic about their future, yet you refer to dentistry as something that's very exciting. What do you mean by that?
Well, I think it is exciting because it would appear as though dentistry is in a better position now than ever before to really help people. And I think that's exciting by itself. But also, when I look at the people who make up dental teams, and I include the dentist and all the auxiliaries on the team, I think that there are terrific opportunities in front of everyone to have very, very meaningful, enriching work experiences. And really, the essence of the marketing concept is all about helping others.
Marketing has been thought of in a rather negative way in dentistry to a large extent because of the fear of hucksterism and so forth that's brought on by the advertising concept. It seems that you're talking about more than just advertising. What's really involved in marketing?
There's really no question that marketing is a very misunderstood term. And probably if you went out and did a person in the street interview and asked people, how do you feel about marketing as a positive social force in our society, I kind of suspect you'd get a lot of pretty negative responses. So maybe I should discuss for a moment what marketing isn't. Marketing is not selling. Marketing is not selling in the sense of persuasion. Marketing is not manipulation. Marketing is not trying to get the other person to do what you want them to do. In fact, Chuck, it's really just the opposite. There are so many different definitions of marketing, but one that I particularly find meaningful is that marketing is all those activities in an organization that result in the total satisfaction of a consumer's needs, whether these needs be self-evident or whether they may be largely unrecognized by the consumer.
I can understand how that concept relates to the general business area where somebody has a product they're trying to sell and convince somebody to buy it, but in the health area where the needs are so obvious, it doesn't seem to fit quite as well.
Chuck, I really have to ask you, are the needs really that obvious? I know we're both aware of the statistics that we hear very often in North America that something less than half of the people in our population receive minimally adequate dental health care each year. That suggests to me that we know that these people have a lot of needs. we know that we're in a position to be able to help them, but that same awareness is not widely distributed throughout the population. And I believe that marketing can help to better communicate to people about increasing their awareness about some of these needs. I think that there are probably 3 elements to the marketing concept that we might want to briefly discuss. The first element is that marketing has a dominant consumer orientation. You're constantly assessing decision-making in an organization on the basis of, is what we're about to do really in the best interests of the patient, not necessarily in the best interests of the practice. So we're looking at a very, very positive consumer orientation. Second aspect to marketing is, Chuck, it's very objectives-oriented. It's future-focused. It's goal-oriented. And actually, one of the objectives to marketing is profit, and that's probably a discussion unto itself. And the third element of marketing, which I think is particularly important for dental practices, is that the marketing philosophy must be integrated throughout the entire organization for it to be effective.
As a behavioral scientist, Doug, I really kind of like talking about these rather abstract jargon words that you're using, but can you really relate something as abstract as marketing to the day-to-day routine of dental practice?
I'm sure that for many people, marketing is a rather abstract concept. Let me try to make it just a little bit more tangible for you. Let's talk for a moment about the Pillsbury Company, a firm in the United States that makes, among other things, flour. If you go back historically to the development of the Pillsbury Company, their original reason for being was basically to produce flour, and so they were a production company. Then needs in the marketplace changed, and needs for the business changed, and Pillsbury started to look at the fact that, all right, we have some products that are available. Now what we must do is learn how to go out and sell these products. And that was the second stage. We went from production to sales. The third stage occurred when someone said, well, we've got a group of products here, but I wonder if those products really fit the needs of our consumers. Let's go out and ask them. So the company went out and started to survey the consumers of their products to find out what were people's needs and how could we better serve those needs. And they collected a lot of data. They went back and they developed a number of products that were more specifically related to people's needs, and that is a part of the marketing concept. So we went from a production company to a sales company to a marketing company. The fourth step in the evolution of the marketing concept occurs when marketing becomes the control element in an organization, when really marketing is the basic motivating force for the entire firm.
If dentistry is a parallel form of business development to that, it seems like maybe we're approaching that fourth stage in dentistry. Can you comment on that?
Well, I think that there are some reasonable parallels. You know, when you think back on Pillsbury, depending upon the conditions that they faced at the time, we really saw 4 very distinct companies. And they had 4 very distinct management styles and philosophies. And it seems to me that one of the things that is now occurring with respect to dentistry is that dentistry is becoming involved with answering the question, what business are we really in?
I'd really like to come back and discuss that issue of what business are we really in. But first, this message. Doug, earlier you mentioned or implied that dentistry as a profession has to decide what business it's really in.
Yes.
What did you mean by that?
Well, dentistry is in a period of change. And when the environment around a business begins to change, I think it offers an opportunity for redefinition. Maybe to put this in another context, I'd like to discuss some of the works of Theodore Levitt, who was a professor at the Harvard Business School. And Chuck, back in 1960, he wrote a classic marketing article for the Harvard Business Review entitled Marketing Myopia. And in this article, he talked about many industries in North American society which had once been growth industries, which were now seen as being in a period of decline. And one of the industries that he talked about was the railroad industry. And I think we're all aware of the difficulties the railroads have had in North America in the last quarter century. Maybe if I could, I'd just like to quote Levitt, because I think the meaning in what he has to say might better be contained in these words. He said that the railroads did not stop growing because the need for passenger and freight transportation declined. That grew. The railroads are in trouble today not because the need was filled by others, such as cars or trucks or airplanes or even telephones, but because it was not filled by the railroads themselves. They let others take customers away from them because they assumed themselves to be in the railroad business rather than in the transportation business.
So are you suggesting that dentists are in a similar situation today? For example, the inroads that are being made by some of the paraprofessionals such as denturists and laboratory technicians?
I think there's a reasonable analogy that can be drawn between Levitt's example of the railroad and dentistry. When I think back on my experiences with dentistry, I would have defined dentistry basically for most of this century as being in the business of fixing people's teeth. And that really fitted with my own personal experiences with dentistry before I got involved in my present capacity. Now, I'm going back, Chuck, about 15 years. You know, I never used to realize that the words dentistry and health were associated with one another. That may seem strange to you. It seems strange to me now, but I never drew a parallel between those two words. I always saw dentistry as something that I knew I needed, but I really didn't want it. It was something that I had to have, but I wouldn't go out and seek it. And it was not something that I really valued. On the other hand, health was something I very much valued. Not only did I value it, but I very much valued the people who were able to help me achieve it, and I would go out and seek help in this area.
If I'm understanding you, Doug, you're really kind of suggesting that the public's image of the dentist as kind of a tooth mechanic, you know, like the dentures and so forth, is really a breakdown in the marketing concept that you've been talking about.
I think, Chuck, it's a breakdown in that concept. It's a breakdown in communication. I've come to believe in the last few years that dentistry and health are not only related, but really dentistry is at the absolute core of health. And if I was asked to define the business that dentistry is in, I think I would say something like, I think that dentistry is in the business of helping people accept responsibility for their own health. And when I think about the overall healthcare system in North America, I can't think of any other segment that is in a better logistical position to really help people achieve that goal.
Okay, so let's assume that at this point, how does a new dentist go out and market this to the general public?
Well, one of the things we have to consider is I'm not sure you can automatically go out and market the helping concept to everyone in the public. If we think back in the past a little bit, when there were, generally speaking, there was a greater demand for dental health services than there were dentists available to provide this service, I think traditionally dentists have viewed all the people in their community as potential patients. I'm really not sure that that's true. And today, when in many areas, probably because of the fact that we're not communicating as well about what dentistry can do to help people, in many areas there are more dentists than there is demand for their services. And I think that what dentistry has to do is begin to look at the fact that a market is not just one group of people. It's broken up into a number of individual segments, and each segment has its own profile, has its own definition, has its own characteristics, if you will.
Does this really kind of explain what's happening in terms of the dental delivery system at the present, such as the advent of capitation and other types of delivery systems?
Sure, I think that the newer evolving forms of providing dental health care are a reflection of the fact that the market is not one piece, it's many different segments. let's try to get less abstract again and more tangible.
Okay,
let's
that
go
might be helpful.
outside the field of dentistry and let's look at something that I think we're all familiar with. Just imagine for a moment, Chuck, that you are the marketing manager for a major North American airline. And you have been challenged with the responsibility of developing some type of a marketing communications program to reach the market. Now, the first question you probably have to ask yourself is, well, who flies on our airplanes? What kinds of people? Are there any profile characteristics that could give us a clue to the type of people that might be passengers? And you might, for example, think about business people. You might think about tourists. And you might think about students. Now, there are many more segments as well, but there's three that we can deal with for a moment. Now, if those three segments are valid, the next question you have to ask yourself is, well, what are the major reasons why each of those segments would particularly choose to ride on our plane as opposed to the other company's plane? Well, I would say that for a business person, his or her major requirement with respect to airline travel is scheduling. Mm-hmm. For a tourist, it's probably something quite different. It may be some combination of in-flight and post-flight services, a broader package that might involve the ability to rent a car once you get where you're going, to have hotel reservations, to have an all-inclusive vacation package. Then let's look at students. What do they really think about when they decide what plane to fly on? I think nearly every one of them thinks about exactly how much is it going to cost me to get on that plane, and I want to be able to go where I want to go for the least possible cost. Those are three very distinct segments, and I suspect your message to each segment would be quite different, even though it might be the same plane going to the same place.
That way of describing the marketing concept of segmentation seems to be pretty clear in relationship to the airlines. Can you draw a similar parallel with dentistry?
Well, I think we can draw a parallel that will fit to some degree. I think what I'm saying is that the people that come into the front door of a dental practice have differing characteristics. And maybe I could divide these people up into three groups. There are what I call post-crisis patients.
Like the emergency patient?
That's right. People that really come and only seek out the services of a dental practice when they're absolutely forced to, and in many cases the forcing issue is pain. Then there are pre-crisis patients. These are people who probably wouldn't say to you that they really enjoy going to the dentist, and they'd probably say that they'd rather be somewhere else, but they realize that they are responsible for their own health, and therefore they must do something to manage the course of their own health. Therefore, they will seek the services of a dental practice. Mm-hmm. But there's a third grouping of people, Chuck, and I think it's this grouping that is providing some magnificent opportunities to private practice. These are people that I would call wellness patients. Someone who is a wellness patient has a very high value for the services that dental practices have to offer. People that are wellness patients not only value the services of dentistry, but in my view, and I wonder if everyone could feel this concept the same way I do, I think wellness patients really find that the dental experience is an enjoyable experience because it is helping them to improve their own health. Those are three characteristics of three different groups of people coming into a practice, and if you can imagine that tomorrow morning you had one person from each of those groups coming into your practice, I suspect that you would probably communicate differently with each one of those people. And that's what I'm talking about here. How can you best communicate with each individual segment in order to fit your message to the needs of that particular person?
So segmentation in the dental field has to do more with the characterization of persons with different attitudes and orientation to dentistry as opposed to a socioeconomic level as such.
I think that's very true. I think here we're talking about profiling people on the basis of their attitude, on the basis of their values, on the basis of their philosophy about health. Really, I think that in many cases their ability to pay, from our point of view, is not a valid criterion. We're really looking at how they feel about health and how they feel about the services that the dental practice has to offer.
What would this have to say for the new graduating dentist, though? Because it seems to me that that would be very limiting for a new dentist to try to segment his or her practice in that way?
Well, I think that we have to recognize that in terms of the economic development of a practice, a new dentist in practice is going to have to deal probably with many of the segments in the market. I don't think there's any question about that. And that's going to be an economic necessity. But as the practice grows, as the dentist matures as a person, and as he or she becomes more focused on the type of practice that they would really like to have, then probably into the future it will give them an opportunity to narrow the segments that they are relating to, and I suspect also give them an opportunity to be able to help people to a higher degree and to have much more meaningful, satisfying relationships in their practices.
Doug, what are your feelings about marketing and the future of private practice, fee-for-service type dentistry?
Chuck, many people are very concerned about the survival of private fee-for-service dentistry. I personally believe that the opportunities for this mode of delivery are excellent for those dentists who will apply the principles of marketing to their practices.
Thanks, Doug. Our guest has been Mr. Doug Young, Vice President of Marketing for a major design and consulting firm. Join us for other programs in this series that are designed to keep you abreast of current topics and trends in the management of a modern dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.